COVID-19 cases are down and Ontario is opening up. Even the provincial capital will move into Stage 2 this week, leaving only Windsor-Essex in Stage 1. How does our reopening here and across Canada compare with other countries? Political science professor Peter Loewen from the U of T's Munk School of Global Affairs and Public Policy is part of a team that's created a way to find out. It's called reopeningaftercovid.com. And Peter Loewen joins us now via Skype from downtown in the provincial capital to explain. Hi, Peter. Good to see you again. How are you managing?
Very well, thanks. And thanks for having me on.
Not at all. Good to see you again. From a policy standpoint, how sound do you think Ontario's lockdown and subsequent reopening strategy has gone?
Well, I think there's two things to say about it. One is that it's really hard to know what works actually when we're talking about these policies, because there's a couple of things that are complicated about it, right? One is that there's a lag between when you open things up and when people start getting closer to one another and when there are spikes in COVID. So it's actually hard to measure it. That's one thing that makes it difficult. The second thing that makes it difficult is that, what we're doing here is we've got government setting a number of rules about what can be open and what can be closed and where people can go and where people can't go. And those rules are sometimes loosely adhered to. So the behavioral responses of people to these rules are hard for policymakers to know with certainty, right? So kind of putting all these pieces together to figure out what's working is difficult. But here are the kind of the success measures, I think, in Ontario so far, that the government's been able to come up with a strategy that is regionally focused. That's important. My parents live in North Bay, essentially zero cases of COVID in that health region. It's not clear to me that they should be under the same degree of lockdown that Toronto should be under. So the province has found a way to basically let different regions open at different speeds. That's important because the longer we keep a lockdown on, the harder it is for people to adhere to it, especially if they're not seeing the benefits of it. So it's successful in that way. And I'd say the second thing is that, social distancing is starting to taper off, but people are still doing the common sense things that they need to do to try to stop the spread of the disease. It'd be better if there was more mask wearing. It'd be better if people stayed home a little bit more, but we haven't seen a complete abandoning of social distancing.
Right. Well, you're a political scientist, but you and I both know there's always been more art than science in politics. And I wonder whether, for example, should we have had more testing before reopening much of the province? Should we have better contact tracing resources in place before reopening? Should there have been stricter quarantine before reopening? How would you answer all of that?
Yeah, so there's three things there, right? One is the last one was contact tracing, quarantining, contact tracing, and then testing.
Yeah.
Look, I think we were frankly a bit slow off the mark on testing. It took us a while to get it up to the level that it should be at. We've got daily rates of testing that are higher now, but I think there are big questions to be asked at the level of regulation and at the level of approving testing for why we don't have more technologies that are allowing people to understand the current state of their health vis-a-vis COVID, and more generally, but vis-a-vis COVID. On contact tracing, I was lucky enough to work with some senators that are working on this question a month ago now. We did a very rigorous study of Canadians. The basic story was that once you explain to Canadians the idea of proximity tracing, you explain to them the benefits of it, and kind of what the trade-offs are between why we need it and what you have to give up to have contact tracing, there's support for it. And I think this has been the one area where political leadership has been most lacking. If I were the government, I would just offer to pay everyone's cell phone bills for the next 6 months if they downloaded a proximity app that had decentralized tracing, and we could know much more accurately whether people have been exposed to COVID than we know now, and certainly much more rapidly by an order of magnitude. Finally, on quarantining, I think we have to do a proper retrospective of what's gone on, and we have to be fair that politicians have been in a very difficult position in trying to fight this thing. This is an incredibly difficult problem to deal with as politicians. But if the numbers are true, something like 1 million Canadians in the first 6 weeks of this should have been under quarantine at some point. And the number, for example, of RCMP checks on houses to see whether people were abiding by quarantines was less than 5,000. We had people coming over the border 3-4 weeks into this pandemic, and we weren't rigorously ensuring that they were going to be quarantining at home and finding a way to really follow up on that. We fell down there. And the result of that is that more people died than needed to die.
We have divided this province up into not quite 36 public health regions, and all of them are open now into stage 2 at least, except for Windsor-Essex. And I wonder if you could compare where we are in our reopening of society to, say, other jurisdictions around the world that you've looked at.
Sure, sure. So we're in a position where, we kind of look like the average around the world. So if I wanted to compare us, for example, to Michigan, right, which is a state that looks a lot like ours, people can do this on our dashboard. They're welcome to do it. What we do is we divide up economies into 9 different sectors, where there are different sets of reopening rules, and then we look at every OECD country, 5 provinces, 5 states. It'll be every province by the end of this week. But you can see where your province is compared to other jurisdictions. So if we compare us to Michigan, for example, we're more restrictive about gatherings. We're more restrictive about border movements, and that we're a little stricter about quarantines on people coming in once they've come into the province from outside the country. We're both comparatively high on manufacturing and construction. You can think about why that is for a second. That Michigan and Ontario would be, in global terms, pretty high in terms of our openness on what we're allowing in terms of manufacturing right now. And then we're the same across everything, except that we're more strict right now on schooling. It means that overall we're lower than Michigan. Ontario sits about in the middle. We're in the same dynamic as most other places, in that we're opening up now at kind of a similar pace that other places are opening up. But we were closed down for longer than some American states, and certainly when you look at the American states which are having explosions now in COVID again, we were much more locked down than them, and you can figure out whether this was good policy or not if you look at those places.
Mm-hmm. How about compared to other provinces? How are we doing there?
We're doing okay. It's basically, it's a bit of a mix. So if I look at British Columbia, which has been a pretty successful case, New Brunswick has been a more successful one. We're actually the same on average, kind of overall where we are. We're more open on construction. They're more open on restaurants. So there's a mixed bag in terms of where we're more open and less open. But overall, we look to be about the same as British Columbia. This is an interesting thing about Canada, right? That there hasn't been really substantial variation in, there's nuanced variation, but there hasn't been really substantial variation across most measures across most provinces. The areas where it's notable have been restrictions on movement, right? So New Brunswick is a very hard province to get into right now. Prince Edward Island is a very hard province to get into. Ontario has not had those restrictions. For example, they'd be hard to enforce within the province because it's huge, but we've not even had them at our borders. How strictly quarantines have been observed and have been enforced is another matter. My impression is the quarantines were more strictly observed and more strictly socially sanctioned, frankly, in New Brunswick, for example, than they were in Ontario. But for the most part, there's been a lot of variation in Canada in terms of deaths with COVID. So many in Quebec, almost none in New Brunswick, none in PEI, less in Ontario. BC is doing better. So there's been all that variation, but there hasn't been actually that much policy variation, which is an interesting question for us going into a second wave.
I want to ask, I guess this next question requires more of a political judgment as opposed to just following the hard data, and that is, the great fear for politicians is, as we reopen right now, that cases will spike up and that they will then have to retrench and close us down a bit more, and that really does get into some difficult, tricky political territory. How do you see the potential of all that unfolding?
I think it's very, very difficult. I mean, I don't know that we've learned any lessons right now that have got us prepared for the fall when we're going to be opening again. I think that's a major constraint, Steve. I'll tell you what my intuitions are. We'll have data to back this up sooner than later, but my intuitions are that politicians are very, rightfully you would be in their position. They're very concerned about deaths. They're very concerned about trying to reduce the amount of mortality around COVID, and they're more likely to weight up deaths when they're thinking about the trade-offs they're making than they are impinging on or impeding on the freedom of citizens to move around, to see family, et cetera, et cetera. Citizens, I think, are less concerned about that, and you can understand why. They don't have to face the voters, and they can be more myopic about these things. But I think that the difficult position that we're in right now, kind of from the politics of it, but also from the policy of it, is that we've wrestled COVID to the ground in Ontario. We're wrestling it to the ground in Quebec. It's been wrestled down in BC. But in Ontario, we haven't completely stamped it out. We're not in the position of New Zealand now where there's no new cases. We're ticking along at 150, 200 a day in Toronto, and we can't shut those down. So what choices politicians make when the disease is there and it's running, right? The infections are running, at a relatively low level, but they're still there, and they're at a high enough level that they can explode if all the kind of shackles are taken off. That's a really difficult position to be in, because you can't simply say, well, 200 infections a day is okay. We can handle it from an ICU perspective. Therefore, we're good to go, right? And we're just going to open things up. So what they need to do is kind of keep encouraging people to persist in practicing social distancing and in being safe about the groups of people that they're together, and doing those simple things around hand washing. They probably need to push on masks a bit more, but they need to figure out how they can do all those things and then get to the fall when we're going to reopen schools, which is really I think that really must be the toughest part of this, because reopening schools is people going back to work, and then it's a whole different ballgame.
Talk to us about masks for a second. There presumably has been a debate at the cabinet table, virtually I should say, as to whether or not they ought to bring in some kind of law or regulation requiring people to wear masks whenever they're indoors, regardless. We know, of course, the Toronto Transit Commission has now put forward, or is about to put forward, a regulation starting in July where you must wear a mask if you ride the TTC, unless you're under the age of 2 or you've got a severe health problem. What kind of appetite among the population do you think there is for that?
I think this is a very difficult issue. I mean, there's two parts to this issue, right? The one is just on the pure evidence of it. Should we be wearing masks? And I think it's, there are scientific standards of evidence that are very important. I think the balance of evidence now scientifically is that mask wearing helps you to prevent from spreading the disease when you have it and you're asymptomatic or you're pre-symptomatic, and we should be doing that as much as possible. And the likelihood that a person contracts the disease if they're wearing a mask and someone else is wearing a mask is very low. So I think the public health recommendation here is pretty clear. If you're out in public, you should be wearing a mask. It's really uncomfortable when it's 30 degrees out, and we're not used to doing it. And look, culturally, we're not adapted to it. So there's that issue. But I think that that's going to be the one thing that can help us really crank down those numbers and wrestle them to the ground farther. So I think at some point politicians are just going to have to accept that they're going to have to force that practice as much as possible. We should have a big retrospective on this, and we want to be even-handed and fair to politicians who are in a difficult position. But I think it's pretty clear that early on in this pandemic, we were talking past each other about what the scientific data was on the efficacy of masks. I think there probably was a political concern about there being a run on masks in the country, and so our public health agencies didn't recommend mask wearing, and they should have recommended it 2 weeks earlier.
Could you sort of get us into the head of policymakers as well, in as much as they're trying to make decisions based on the most up-to-date information that they have, but sometimes there is a lag between reporting time, between the most up-to-date information and the time at which they have to make a call. How difficult is that for them?
Oh, I think this is remarkably difficult. Look, human cognition is such that we're just bad at making connections between a cause and some effect when there's any delay between the cause and the effect. And this is a disease which has these social dynamics. It's a virus which has social dynamics in how it spreads, and we don't know how to control those behavioral things that kind of that cause the disease to spread more or less. And we have a hard time kind of seeing cause and effect between a closing or an opening policy, because we actually don't know as much as we need to know about how the disease transmits, right? But also that there's all those things that happen between when a policy is put in place and then when you can actually see the numbers that may be the result of that policy. A kind of anecdotal example is that, there was a concern that after all those young people got together in Trinity Bellwoods Park, and understand why they did, and there were 10,000 people in what's a pretty small park, that there would be a spike in cases. Not a huge amount of evidence that happened as a result of that. Not a huge amount of evidence that corona is spreading because of the mass gatherings in the United States. We should be as even-handed as possible in getting those data. But the point is that we don't know enough about how the disease actually transmits to be able to make precise recommendations about how the virus transmits, to make precise recommendations about what mix of policies are perfect. So, what you have then are politicians who are engaging in a lot of risk-averse behavior, right? Where they're saying, let's keep things locked down a little bit longer, and we'll write the checks we have to make up for people's lost income. Let's keep things locked down a little bit tighter because we just don't know what's going to work, but we know that this big mix of locking everything down seems to work.
Well, we do know there is some fatigue with all of these protocols that are now in place, and we've got a chart here that we'll share with you and our viewers, and I'll describe it a little bit for those listening on podcast. If you start at the left of this chart, you see there is pretty good adherence to the notion of social or physical distancing. About 3/4 of the people, and it really doesn't matter what part of the country you're in, it's still pretty high adherence to these protocols. But as the months go on, and just follow those squiggly lines to the right of the chart, and you can see, and again, for those who can't see, I'll describe it, there is less adherence as you go along, to the point where by the middle of June, you've got a good 5, 10, 15% of people starting to decline to follow the measures of social distancing. How do the politicians continue to get people to try to buy into a policy that they look like they are fatiguing from?
Yeah, this is a very difficult one. So let me just say two things about it quickly. That there's the way we measure social distancing in this case is we ask people whether they've what percentage of the following 6 things they've done. These are easy things, avoided crowded places, avoided in-person contact with friends, families, and acquaintances, maintained 2 meters distance, avoided domestic travel, avoided public transit, and avoided the grocery store at peak times. Not overly difficult things to do, though actually hard to maintain for a long time, right? And to do on a week-over-week basis. And the story is that people were doing about 3/4 of those things at the start of this, and now they're doing about 2/3 of those things, or 60% of those things. The declines are most pronounced among people who are younger. They're more pronounced among men, but they're most pronounced among people who are younger, who feel a little bit more invincible. Our data is the following: that when people are exposed to the economic costs of social distancing and of a lockdown, when they're told about what the future costs are likely to be, or for example, when a big report comes out like the April jobs report that showed just how severe the cost of this lockdown has been on the economy, they expect that other people are going to defect from social distancing in the future. So they themselves think that they're going to defect from it. So we've got a big coordination effort here, right, where everybody's kind of in this together. Everybody's socially distancing because they understand that it's good for them, but it's good for other people. But people are looking down the pipe and saying, boy, this thing is going to be very costly to keep doing. So I don't know that I'm going to do it forever. And they know that other people are saying that. So what I worry about is that we're really on, not a knife's edge, but we're at a point where people start compromising on more of these things. They start going to stores more. They start seeing more friends and their family and their grandparents because they miss them. They start going to public places more. To keep community transmission down. And finally, the people who are least willing to keep abiding by this, and politicians I think know this, are young people, those 18 to 34, and those who live outside of cities, because they're saying, boy, why am I engaging in all this social distancing when the virus is in Toronto, but it's not in Timmins, or it's not in Sudbury, or it's not in North Bay, or it's not in some other place that's been able to wrestle it down to the ground. So I think that the long story short here, Steve, is that the challenge for policymakers is that it becomes more and more personally costly for people to keep up this social distancing. So they've got to convince them that it is the right thing to do. And if they're not going to do it, there's got to be some alternative like masking.
Right. Peter Loewen, professor, Munk School of Global Affairs and Public Policy at the U of T. Always good of you to join us here on TVO. Thanks so much and be safe.
Thanks very much, Steve. You too.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.